When treating low back pain, one of the key muscle groups I focus on is the gluteus medius and minimus, are located on the outer surface of the pelvis, just below the iliac crest. You can find them by placing your hands on the side of the hip and feeling for the firm muscle just behind the bony prominence of the greater trochanter. These muscles are key stabilizers of the pelvis, especially during walking and standing on one leg. Right now, I'm working on one side, applying gentle but firm pressure. I don't press too hard. It's important to avoid causing too much pain. If the patient starts squeezing the muscle or shifting uncomfortably, it means the pressure is excessive. The goal is to release tension, not to create more. After about a minute on one side, I move to the other. The same careful, controlled technique, just enough to stimulate circulation and help the muscle relax without overwhelming it. Massage, by its nature, is a form of controlled trauma to the tissues. If you overdo it, pressing too hard or working for too long, the area can become inflamed instead of relaxing. That inflammation can actually make the pain worse and reduce any therapeutic benefits. The key to effective massage isn't force. It's precision and understanding how the muscles respond. If done correctly, this helps restore movement, reduce pain, and support long-term recovery. By applying steady but controlled pressure, I work through the layers, gradually releasing tension without overstimulating the area. Beneath these muscles, some important nerve roots run down toward the leg. When the gluteus medius and minimus become tight, they can compress these nerves, leading to tingling, numbness, or pain radiating down the leg. Symptoms often mistaken for sciatic nerve irritation. By releasing these muscles, we can often reduce or even completely eliminate these symptoms, allowing the nerves to function freely without being compressed. Now, I'm using two massage guns. The reason I use two at the same time is that when positioned close to one another, they create opposing vibrations. These vibrations don't just work on the surface, they go deep into the tissues, reaching layers that are difficult to access with hands alone. The alternating waves of pressure help loosen up tight muscles, improve blood flow, and stimulate the nerve endings beneath the muscles. One of the biggest problems for people who sit all day, whether at a desk, in a car, or even on a couch, is that prolonged sitting compresses not only the muscles in the glutes, but also the nerves that pass underneath them. This constant pressure affects circulation and nerve function. Over time, the nerves become desensitized, almost like they've been put to sleep due to the continuous compression. That's why many people experience stiffness or even pain when they stand up quickly after sitting for too long. The compressed nerves don't immediately fire properly, and the glute muscles aren't able to activate as they should. Instead of the glutes engaging to stabilize the pelvis, the lower back takes over, bearing most of the weight. This overloads the lumbar spine and often leads to discomfort, tightness, or even sharp pain. By applying deep tissue vibrations with the massage guns, I'm helping to reverse this process. The rapid, deep pulses wake up the nerves, restore circulation, and encourage the glute muscles to activate again. This is essential for proper movement and stability. When the glutes and deep hip stabilizers are functioning correctly, they absorb force and distribute it properly, which means the lower back doesn't have to compensate. This technique is especially effective for people who experience lower back pain that worsens after long periods of sitting. Many times, the real issue isn't actually the lower back. It's the lack of activation in the glutes and the compression of the nerves beneath them. When we restore normal muscle function and reduce nerve compression, the pain often disappears or is significantly reduced. So, by using these deep vibrations, I'm not just relaxing the muscles, I'm reactivating the entire system, helping the body remember how to move efficiently without unnecessary strain on the lower back. It's a powerful way to relieve pain, restore movement, and prevent future discomfort. As you've seen, releasing the right muscles and stimulating the nerves can make a huge difference in how your lower back feels. If you sit a lot, if you have nagging lower back pain, or if you feel stiffness when you stand up, don't ignore it. These issues don't just go away on their own, but with the right treatment, they can improve fast. If you found this helpful, make sure to subscribe and turn on notifications so you don't miss my next video. I'll be sharing more techniques, exercises, and treatments to help you get rid of pain and move better. And if you've tried this before, let me know in the comments. Did you feel a difference? See you in the next one.